Teclistamab was originally approved in the United States with weekly dosing back in the fall of 2022 for patients who've had four or more prior lines of treatment, including a proteasome inhibitor, immunomodulatory drug, and an anti-C38 monoclonal antibody. Based on the Majestic 1 clinical trial that looked at a total of 165 patients, in that particular setting. And while the responses were very impressive at over 60%, one of the things noted was a higher infection risk as patients continue to have treatment. And then subsequently, the protocol had allowed Q2 and Q4 week dosing for patients if they had a sustained response, of PER or VGPR or better, for at least 6 months. And that was in varied times on that protocol. On the real world side, at our center, we started to do de-escalation quite early, as early as 3 months or, after 3 cycles of teclistamab. And that's the experience my colleague, Dr. Carleen Tan, shared at ASCO and EHA, where we looked at the sustainability of response if we go to Q2 and Q4 week dosing after the first 3 cycles of treatment. And what we noted in our experiences after that switch, patients, vast majority of patients, about 94% of the patients, continue to have sustained responses at the 6-month mark. And that, is an important observation. If we can de-escalate treatment with teclistamab in a real world setting, then we'd be able to mitigate that infection risk. The other thing that, we have noted in our experience, as a single center, having treated, 86 odd patients with teclistamab, for that particular analysis, that most of these patients would not have qualified for Majestic 1, because of age, comorbidities, and other, parameters. So this does appear to be, consistent with what was seen in Majestic 1. So, responses are reassuring that you're using a real world patient population. So you're seeing, a lot of similarities with the clinical trial data.